everyone, welcome to my show. My today's guest is Dr. Manish Singhal, Senior Consultant Medical Oncology, Apollo Hospitals. Hi sir, welcome to the show.
My great pleasure to be here.
Thank
you
sir.
So much.
Thank you for sparing time because I understand how busy you always.
No, it's okay. If it comes to public awareness and general awareness, I think we all have a duty towards that.
So that's really nice of you. I think it's important for us to educate women, especially in today's time, since you know how actively I'm involved in empowering women, especially for their health. So I think we can have a great discussion around oncology in terms of women's health. So I have all my questions ready for you. Are you ready to answer?
Of course, yes.
Great. So my first question to you is, what are the common type of cancers that we commonly see these days in women?
So I think the first and the foremost is breast cancer. So we know that, if you look at any cancer incidence, breast cancer ka incidence is increasing across the world, and so is true for India. So we are seeing a lot of breast cancer patients. I would say that in a busy cancer OPD, breast cancer would account for 20% of total cancers that we see. If not 20, at least 15%, definitely. So that's the first and the foremost. Then comes the cancer of the uterus and cervix. Thereafter, it's ovarian cancer. And then comes the lung and the colorectal cancer, which is common for both sexes. But then these are the most common cancers which affect particularly women.
And if we talk about the age, like in olden days, people used to think कि जैसे age बढ़ती है, cancer के chances लोगों को लगता था कि ज़्यादा बढ़ते हैं. But nowadays, considering all the factors or the risk factors that are involved, earlier stage क्या लगता है आपको, that especially for women, if we talk about, what is the earlier stage at which we can see patients being detected with cancer?
You are right. I think anybody who has a cancer patient in their family or in their near and dear ones, वो लोग ये मानेंगे कि कैंसर की कोई एज नहीं है. And as a matter of fact, of course, what you have brought up is absolutely correct. कि पहले हम लोग सोचते थे कि that cancer is a disease of elderly people, बुजुर्ग लोगों की बीमारी है. But now it is said that it can affect any age group. And right from very small child, of 6 months old child can have a leukemia. But of course, the cancer types are different. My youngest female patient with cancer was 17 years old who had a very advanced colorectal cancer, which is large intestine, बड़ी आंत का कैंसर. कोई जेनेटिक हिस्ट्री नहीं थी, कुछ नहीं था. एंड जो सबसे ज़्यादा बड़ी चिंता की बात है वो है कि इंडिया सीज सेम कैंसर विच वेस्टर्न वर्ल्ड सीज, यानी कि हम यूके और यूएसए की बात कर रहे हैं. वी सी इट एटलीस्ट 1 decade earlier. That means there are more younger women who are getting affected with cancer. The average age for breast cancer is 40 years, which is 50 plus in the US population. Generally हम US को उदाहरण बहुत देते हैं because वहाँ पे सबसे ज़्यादा कैंसर रिसर्च है, बहुत ज़्यादा डेटा है, स्टैटिस्टिक्स बहुत क्लियर हैं, they collect each and every data, but that is quite worrisome कि हमारे यहाँ जो भी कैंसर्स हो रहे हैं वो 1 decade पहले हो रहे हैं. That means useful life of the year is lost in battling cancer. So yes, cancer incidence is slightly higher in our country in younger people and younger women, and which is definitely a worrisome point.
And even if we talk about marriages, which is quite getting delayed these days because couples are career oriented, women are also working these days. So probably I feel that somewhere we also see that the pregnancies are getting delayed.
Yeah, that's true.
But in case there are women at younger age also getting detected with cancer, and when the whole therapy starts, the treatment starts, what are the consequences on the fertility?
You have brought up a good point that marriages are getting delayed, and that should not be the case. Certainly not. And there's an old saying in English, a stitch in time saves 9. So I say that a knot in time saves 9. So certainly when we were studying, it used to be said that if you have your first child after the age of 30 years, you increase the risk of breast cancer almost double-fold. And I think your 2 books which are there also speaks of the same thing, that it's very important. Childbirth and breastfeeding both are very important. Fertility, well, if you have completed your family right in time, then this issue is not going to come. I did mention that age is in India, the age of getting cancer is younger than, at least 1 decade younger than what is seen in the Western population, but still it is not like 30 years. So I think it is very important that we complete all spheres of our life well in time. Career is, nobody is stopping to become, from you becoming a doctor or something or whatever you want to become just because you are married. I think you can definitely complete your family and then get on to the career a bit later. But in case somebody does get, and I think fertility does become a very important issue, and this is something which we are experiencing on daily basis in our OPDs because younger women are getting. Even now, last week I had a patient who they were almost engaged, not yet married, and the female got breast cancer, and the fiancé had come and they were sitting across that, what do we do now? What are the implications on fertility now? So fertility does get hampered because of the chemotherapy. Is a cytotoxic drug. जब हम समझते हैं कि भी chemotherapy काम कैसे करती है, dividing cells को मारती है. So dividing, we all know that the uterine cells or the ovarian cells or the germ cells are also dividing. Menstrual cycles हर महीने आती हैं, तो वो dividing cells तो वो भी हैं, तो वो they are taken up, they take a hit. But the good thing is now there are a lot of studies which are being done in this regard so that patients do not lose on their fertility. In males it is very easy, sperm banking can be done. But in female, ova is released, just one ova is released once in a month. So it's very difficult to have a ovarian or a oocyte or ova preserved. It will delay your treatment by at least a month or 2 months. Sometimes you may not even get an ova. So there are certain injections which are given, which are called as LH-RH agonists, which can stop the menstrual cycles. It works by making the cells stagnant there and there under the impact of that. So if your cells are not dividing, they are not going to take a hit. So there are randomized controlled clinical studies which have been done, and we use it quite routinely in female patients, where we hold their menses, we get their menses on hold, and then we are able to institute the chemotherapy very safely. मतलब हम chemotherapy उसके बाद कर सकते हैं. The success is in excess of 70-80%. Of course, it also depends on their age when we start. And if they are quite young, they are likely to retain their fertility with this therapy. Sometimes if we have time, we can do oocyte preservation or ovarian preservations. And oocyte is the egg can be preserved, and then that can be used later on. But most of the time, the most practical thing is to use these simple injections. They are given in the tummy once in a month. It's a subcutaneous injection, and we are able to preserve the ovarian functions. As a matter of fact, in breast cancer, sometimes hormone therapies are given for long durations. And now there is a study which was published very recently in New England Journal of Medicine, which is called as the positive trial in breast cancer patients, where females can safely hold their hormone therapy after a certain duration of time, get pregnant, have a child, and then restart their hormone therapy without actually decreasing their chance of cure. So such studies are now being worked out. It's the first ever study done in the world.
Wow.
Which is called as the positive trial, and the results were thankfully positive.
Nice. I think there's a lot of new things, new innovations happening in terms of cancer treatment, which is again ray of hope for cancer patients.
Certainly.
Yeah. Because I think as it is, when people hear the word cancer, they get scared, and of course it's a term which is quite scary, and people get worried and they get so stressed, and then on top of that you also have to worry about your fertility, preserving that. So I think I'm sure it becomes too much for women to handle, and even for that matter, even for guys. So what would be that one message that you would like to give to such women, that how can they manage that stress during that period?
So I think it's a two-pronged answer. One is don't delay things too much. There is always a good time and the right time for doing something. So as I said, that a knot in time saves 9. So that is not only make such certain hormonal changes in your body, pregnancy and childbirth and breastfeeding, which will not only protect you from many cancers, including breast cancer, which is the topmost cancers that affects women, but also in case you have chosen the other path, the science has really progressed quite much, and we are there to help you out and take you informed decisions. And there are therapies which can not only cure your cancer, but also help you retain your fertility and carry on a good normal life.
I think that's why it's important for women to come to the right doctor with good experience. I think it is very important to choose your doctor wisely.
Well, I think the good thing about medical science is it's there in black and white, and it's there, and anybody, it's accessible to everybody. It's not like the other sciences where it's not accessible. So our science is quite accessible, and we do encourage patients to read the right stuff and go onto the right websites in case they need more knowledge.
But then also I would like my viewers to know that Dr. Manish Singhal is one of the best medical oncologists in India. So in case you know anybody who requires any special therapy, especially being diagnosed with cancer, you can always take an opinion from him.
My pleasure.
So my next question to you would be that, even when we talk about uterus cancer, so a lot of times we see जब menopause होता है तो घर के बाकी लोग बोलना शुरू कर देते हैं कि अभी यूट्रस का कोई रोल नहीं है, तो यूट्रस कैंसर ना हो जाए इसके लिए आप अपना यूट्रस रिमूव कर लो. सो एज अ मेडिकल ऑन्कोलॉजिस्ट इस बारे में आपका क्या टेक है कि इज इट a feasible thing to do कि menopause हो गया तो uterus remove कर लेना चाहिए as a preventive measure to cancer, या we really should not worry about that?
Well, if I were to answer this question in one word, the answer is no, right? But to qualify my answer, I think it's absolutely unwise to say that you can remove your organ because you don't need it anymore. As a matter of fact, somebody can put a same remark for breast cancer also. अब तो ब्रेस्ट फीड नहीं करना है, अब तो आपकी एज हो गई है, मेनोपॉज हो गया है, सो perhaps it is not even a sexual organ now, so why don't remove your, so what all organs are you going to remove? So of course any surgery has its own risk. Even a bariatric surgery or a weight reduction surgery or a simple surgery or liposuction surgery can have risk. So no such surgery can be done just because you are fearful of having cancer in that part of the body. So it is definitely not advisable. And we never advise preventive removal of uterus unless until somebody has got a genetic risk profile. And that too, it is having an abnormal gene in the body is not a guarantee to get cancer. क्योंकि आपको तो कैंसर होगा ही होगा. I give this example to everybody, and people do discuss genetics nowadays in our clinic. मतलब बड़ी आम बात हो गई है और काफ़ी लोगों को इस बात की समझ आती है कि जेनेटिक्स के बारे में. But I definitely explain them कि having a abnormal gene is not a guarantee to get cancer. Similarly, every smoker will not get lung cancer. It's only a high risk for lung cancer, right? But that doesn't mean कि अगर आप स्मोक करते तो आपको लंग कैंसर होगा ही होगा जी. So same way अगर genetic abnormality है, so it requires a lot of discussion. How much is the risk? It also is which gene is involved. So not all genes have very high penetrance. Some genes may not have as much penetrance. Some genes will have more penetrance. So your risk will change. कि अगर lifetime risk in general population से X है, तो आपका X+2 है या X+1 है या X+1.5 है, हमें नहीं मालूम. So जीन के अकॉर्डिंग पता चलेगा. Then the person can take an informed consent कि यार मेरा रिस्क बहुत ज़्यादा है. For example, BRCA1 gene, certain genes may have almost 80% chance of having lifetime risk of having breast cancer. 80% is very high. So perhaps that person would think that okay, let me complete family breastfeeding, etc., and then I'll get both the breasts removed so that the at-risk organ is removed. But if your risk is just about 12%, which is 8% for general public and 12% for you, you may not like to remove the organ. So it is quite variable. But in general population, the answer is very simple. No uterus removal just like that. Every surgery has its complication. Even if it is 0.1%, you don't know where you will lie.
Right. And breast cancer का risk क्या men में भी हो सकता है?
So yes, 1% of total breast cancers that we see is men's cancer. We have a significant number of men who have had breast cancer. Usually any man who is diagnosed with breast cancer should get a genetic test done because it's very rare to have a breast cancer in men, but it is well known. And likely it's not always, but then likely they have some genetic predisposition, so a genetic testing should be done for them.
So since आपने genetic testing के बारे में बात किया है, अगर किसी की family history है, and because breast cancer is quite commonly seen, so what are those special testing that one can get done in case of they want to know कि उनका कितना percentage risk है, and what are the preventive measures that they can take?
I think very imperative question. So I think genetic testing, it has become now mandatory to discuss genetic testing in the clinic. every time you have a breast cancer patient. But that doesn't mean that you have to get every woman tested for genetics. It's costly, still quite costly. I will say if you have to have a good genetic testing done from decent, good lab, it costs you about 30,000 to 35,000 rupees. So you just cannot throw the test for everyone. So there are set guidelines. If there is no other family history of breast cancer or ovarian or uterine or any other cancer which are genetically linked, many people confuse with lung cancer. Lung cancer तो भी smoking से या किसी और चीज़ से होता है, उसका कोई genetic link breast cancer के साथ नहीं है. Oral cancer है, esophageal cancer, उसका genetic link breast cancer के साथ नहीं. Breast cancer is only linked to breast, ovary, prostate in males. उनके घर में कोई मेल को prostate cancer हिस्ट्री और pancreatic cancer. So इस तरह की कैंसर अगर हिस्ट्री है तब उसको हम फैमिली हिस्ट्री सिग्निफिकेंट मानेंगे. या फिर उनकी एज 50 साल से कम है तो जेनेटिक टेस्टिंग का इंडिकेशन बनता है. या हाई रिस्क या हाई ग्रेड जिसको हम ट्रिपल नेगेटिव ब्रेस्ट कैंसर कहते हैं, वो कैंसर है जो 60 साल से कम की उम्र में, तो यानी कि वहाँ 10 साल का हमें एक वो मिल गया एक्स्ट्रा 10 साल. अगर इफ यू आर लेस देन 60 years एंड यू हैव अ ट्रिपल नेगेटिव ब्रेस्ट कैंसर, any type of breast cancer less than 50 years of age, or anybody with breast cancer with some family history, usually not in third degree relative but in the first degree or a second degree relative, any cancer history, be it be a breast, ovary, prostate or pancreas, then you have to do a genetic testing for them.
Which is at what age?
So any age. So any patient who walks in and has a breast cancer. So for example, I have a patient walks in who is 48-year-old female, doesn't have a high-grade breast cancer but any breast cancer. I'm going to discuss genetic testing. So somebody walks in who is 58 but has a triple negative breast cancer, which is a high-grade breast cancer. I'm going to discuss genetic testing with them. Right. So somebody walks in who is 58, has a low-grade breast cancer, but her sister has been diagnosed with breast cancer, living in Bangalore or in America, and has got a breast cancer, and another cousin has had ovarian cancer. I'm definitely going to do genetics testing. Somebody who's 65, quite elderly, the higher the age, the more likely chance that it is a sporadic cancer. So the take-home message over here is that those who have genetic cancers are generally diagnosed at an early age or a younger age rather than late age. Somebody is 70-year-old but has strong family history. उनकी दो सिस्टर्स को हुआ है, उनके एक मामा को हुआ है, उनको prostate cancer था. Then I'm going to do genetic testing because family history has become strong now. So if the age advances but strong family history, do genetic testing. If age is very young, then do genetics testing. But if somebody has a high-grade breast cancer, do genetic testing. So there are set guidelines. So it's not for everyone, but it is there and it may give you relevant information. The ballpark figure of genetics involved is about 10%. That means 10% of total breast cancers, 8 to 10% of total breast cancers that one sees will have some genetic predisposition.
Right. And what could be the other factors apart from family history? You know, nowadays we have a lot of pollution happening everywhere. The AQI is going so worse. So, आपकी side से आप वो कौन-कौन से factors आप लोगों को awareness के लिए बताना चाहेंगे that can cause cancer?
So simple, timely marriages, timely childbirth. You can't really control your age of menarche and menopause. If there's an early menarche and late menopause, your body is getting exposed to the hormones for a longer duration of period. So that can affect or increase the incidence of breast cancer. Or air pollution, yes. I was in Spain this October. In Madrid, there was a large meeting, medical oncology meeting, and the French people published their result about air pollution contributing to breast cancer. And so the incidence of breast cancer increases with increasing particulate matter 2.5. We don't realize it because it's not going to happen in one day. It's not going to happen in 1 year. It's going to happen over a period of 10 to 20 years. So air pollution definitely contributes. Smoking contributes. Alcohol intake can contribute. Sedentary lifestyle contributes. Obesity contributes. So I think stress contributes. Of course, it's very difficult to measure stress, but stress definitely contributes. So all these things are modifiable. You can't modify your genes. Genes तो नहीं बदल सकते. But ये सारे factors को बदला जा सकता है. And so take on to healthy diet, try to avoid air pollution. You can have air purifiers set in, or don't go out during the more polluted time. Do regular exercises, drink good amount of liquids, don't take to smoking. Alcohol is okay in a very limited quantity occasionally. If I were to quote American Cancer Society, it allows 1 drink per day for a female and 2 drinks per day for a female. If it is a hard drink, it's about 25 ml of 2 drinks, but for a female it is just half the quantity, 1 glass of wine or a pint of beer. So this is what of course if you choose to drink, then this is the safe quantity, and no binge drinking, no smoking. These are the things I think which can definitely help you beat cancer before it comes to you.
Any specific role of plastic in causing cancer?
Yes, UK Cancer Research, if you type on Google cancer and plastics and cancer, the UK research, so it does have BPA. BPA is nothing but bisphenol A. Bisphenol A is a weak estrogen, and that is what leads to more the estrogen, more the chance of having breast cancer and other hormone related cancer. So it can definitely lead to cancer. So I think it is wise that you read the recycle number. There's a recycle sign on every plastic, and then there's a number written on it. I think 1, 3, 5 is okay to use. 2, 4 and 6 is not okay to use, or even 1, 3, 5 is okay to use the way it should be used, like once. Don't reuse your plastic bottles for drinking water. The recycle sign with the number 7 is the safest because it's a plant-based plastic. It is called as BPA-free plastic that is generally used for children, for their water bottles and their infant bottles. So that is the safest plastic. But of course, if one can avoid plastic, because plastic can over a period leach and go into your food products. So it is always good to use only safe plastic. You can't subtract plastic altogether. मतलब आपके घर में जो पाइप लगी होगी जिससे पानी आ रहा है वो भी शायद प्लास्टिक ही होगी. You can't change that, right? So we have to deal with plastics, but
at least from the kitchen we can try to remove it.
Yeah, we can try to, or only high quality plastics should be used because that does not leach.
Right. I think making a proper lifestyle switch is very, very important.
Yeah.
Not just in preventing cancer, but even overall for improving fertility. Even gynecologists say that, it is the lifestyle modification which will help you to conceive naturally. So I think, I hope people who have watched our episode today are going to, take home a message that your overall lifestyle can help you to prevent, a lot of diseases which can be very, very life-threatening for you. And not just you, even your family members, your kids. You need to set examples. You need to ensure that सिर्फ आप अपना ही नहीं, आप अपने आसपास के लोगों का भी, अपने घर वालों का भी lifestyle change करवा रहे हैं. Sir, any last takeaway message for people?
Cancer is a reality, and it is not that it cannot affect someone. It can affect any one of us, anyone, even me or anybody. So it's always good to, be aware. Don't ignore your symptoms. If something is wrong, it is very wise that you bring it to the notice of your near and dear ones, and they can take you to the hospital and see a specialist. And of course, with good lifestyle, you can beat it. And it's easy said than done, because I think we are all bogged down with so much stress of staying alive, or staying upbeat, or be professionally sound, and etc. But I think it can still be done. If wherever there's a will, there's a way. And in case you are unlucky and you get affected, then we are there. And the science is progressing quite rapidly. And I think we are able to, I'm not saying cure 100 out of 100, but then cure a majority of patients now.
Yeah, I think, it's very important that people listen to happy stories, positive stories. There are people who get cured, there are people who are living absolutely normal. So I think उस time पे जब आप ऐसी stories सुनते हैं, एक आपको अंदर से एक positive energy मिलती है, rather than listening to negative stories and hearing that okay, so and so person could not make it, was not able to cope up with the treatment. So I think listening to positive and happy stories are also very, very important.
Very important. And needless to say that an ounce of prevention is better than a pound of cure. So always we should work on prevention more than cure.
And like you mentioned, prevention, I would like to advise, please go and get your cervical vaccination done, and especially for the daughters also. So even I'm sure, sir, you would also like to endorse that
of course,
cervical
there is
cancer
no doubt,
vaccination.
Unfortunately, it's not a part of our national immunization program, but very soon it would be, because we are making our indigenous cancer vaccine. And mind you, this is not cancer vaccine for all cancers, it's only for cervix cancer. And Mr. Poonawala will be rolling out this vaccine very soon, and once it is there, the cost will decrease, and perhaps it will become a part of the national immunization program. So at least one cancer can be prevented, because there is a good protection with the type of vaccination against the HPV infection, which would protect not only from cervix cancer, a few oral cancers and few anal and penile cancers as well.
So thank you so much, sir, for sparing
My
time
pleasure.
for this, and thank you everybody for watching this.